Hello, and welcome virtually to the Texas Public Policy Foundation. My name is Rob Henneke. I'm the General Counsel with the foundation, and we're thrilled to have you here today for this great discussion on healthcare, on the courts, Congress, and the future of care. We're going to have a great discussion here. The subject could not be more relevant. And right now, joining with me is my friend and colleague, David Balat. David is the director of our Right on Healthcare initiative for the foundation. And you may be noticing that neither of us are Congresswoman Cathy Rodgers. The Congresswoman will be joining us. She's finishing up some business in our nation's capital, running a few minutes late. We'll join the conversation here shortly. And at that point, I intend to do a full introduction and to bring her in the discussion. But we didn't want to keep you waiting. And so I'm ready to get started. And the first thing that I would do, again, in welcoming you to this discussion, is to let you know that the way we're going to do it, we're going to have a conversation about healthcare, and then really want to turn it to your questions here towards the end, which you'll be able to submit electronically, and we'll get to as many questions as we can. So my role at the foundation is as the general counsel of our litigation center. And as part of that role, the Texas Public Policy Foundation was lead counsel for the individual plaintiffs in the constitutional challenge to the Affordable Care Act that was argued last November before the United States Supreme Court. This was the case the trial court agreed with our position, where we were co-plaintiffs with the state of Texas, that because the individual mandate, the command on people to have to buy health insurance under the Affordable Care Act was unconstitutional, then that was a fatal flaw to the entirety of the Affordable Care Act. And the trial court agreed that all of the Affordable Care Act would have to be invalidated as a result. Now, we know that the ramifications of that decision were stayed while the case was taken up through appeal. We litigated the case through the Fifth Circuit Court of Appeals and argued it last November before the United States Supreme Court. But the context of why we're having this discussion here is because we are weeks away, if not days away, from the United States Supreme Court announcing its opinion in the California versus Texas lawsuit that we were part of, challenging Obamacare, challenging the Affordable Care Act. So this is a great reason to check back in and to look at what the state of affairs are in terms of healthcare. So this won't be much of a legal discussion, because really what's most important is how Americans are able to access the health care that they want, that they need for their families, how they're able to afford it, how they can have empowerment to have control over their health care decisions. But we know that so much of that is being blocked by the Affordable Care Act. So without knowing what the Supreme Court is going to do, I think that there are three potential outcomes in the case. And we'll know in a few weeks which one is right. On the one hand, it is possible that the Supreme Court could agree with the trial court that all of the Affordable Care Act should be struck down because the cornerstone of the Affordable Care Act, the individual mandate, is unconstitutional. Option one on the table is whether the Supreme Court would affirm the trial court and strike down all of the Affordable Care Act. Another option, one that's also likely, is that the Supreme Court would find that the individual mandate is unconstitutional, but only strike down that position, only strike down that provision, leaving the rest of the Affordable Care Act in place. The third option that's possible is the Supreme Court could say that because Congress no longer has a penalty associated with the individual mandate, then there's no harm, no foul. And without an injury, then the case should not be resolved at all. I think that one of those are the three most likely outcomes, but we can agree here today with our featured guest, Congresswoman Cathy Rodgers, welcome to the foundation, that healthcare, regardless of how the Supreme Court resolves the pending constitutional challenge, will continue in any outcome, any scenario, to be a critically important issue for Americans in the United States. So even though we'll have this court ruling, nothing that the Supreme Court can or would do is going to fix healthcare in America. So I want to pivot then for our discussion to talk about what we need to do and where things stand and what a path forward is on that. And to do that, first of all, I'm thrilled to welcome virtually to the Texas Public Policy Foundation and our featured guest here, Congresswoman Cathy Rodgers. The Congresswoman represents the great state of Washington and has done so since 2004. Part of the highlights of her career was being the chair of the House Republican Caucus from 2012 to 18, and currently serving as the vice chair of the House Energy and Commerce Committee. And really, Congresswoman Rodgers has been a champion of healthcare during her tenure. And specifically, I want to highlight a couple of legislative successes that she championed, specifically including passage of laws in 2015 and 18 that expanded access to speech generating devices with people with ALS. Cathy's been married for 15 years. She's got 3 beautiful children that I saw and looking at her website this morning. And Congresswoman, thank you so much for joining us here today.
Thank you, Rob. It's great to be with you.
And also with us is my colleague and good friend, David Balat. David is the head of our Right on Healthcare initiative with the foundation. David's background is in hospital management as a hospital executive. He has over 20 years in the industry and is also now a leading national expert in healthcare, having been invited to testify before the United States Congress on healthcare, as well as a featured speaker across the nation. So David, Cathy, welcome to you both, and really looking forward to jumping into this discussion. But Congresswoman Rodgers, if I can start with you and asking you to kind of set the table for us, that here we are in May of 2021. And I'd like for your thoughts in describing where things stand today on healthcare in America under the Biden administration.
Well, thank you. Thank you, Rob. It's great to be with you. I'm looking forward to this discussion. And clearly, the Biden administration, the majorities in the House and in the Senate are really taking healthcare towards a socialist approach, a government-run healthcare system. And we have a lot of work to do to make sure that America leads in healthcare and healthcare reform with a uniquely American solution. That is the solution that is going to ensure that we continue to lead in having better care and that we continue to lead in having a modernized healthcare system. So I believe that we need to continue to focus on the importance of price transparency in our healthcare system. This is what would empower patients so that they would have more control over their healthcare dollars and their decisions. And it would also foster competition, and that's how we help drive down the healthcare cost. I believe that we absolutely need to take action to lower prescription drug costs, but I do not want the government price controls that Speaker Pelosi and the majority are promoting right now that would be a damper on innovation in America. We need to spur more private investment for breakthroughs in cures and treatments. And always remember that the best solutions to healthcare and to the challenges that families have do not come from Washington, D.C. So we need to make sure that we're encouraging the states and the local communities to tailor healthcare solutions that are going to best meet their needs.
Well, that's very well said, and thank you for that. I know you're very active in your district and with your constituents. One issue that continually comes up is affordability. 2/3 of Americans cite affordability as one of the main reasons that they are dissatisfied with their health care and with their health insurance. Mm-hmm. A quick follow-up to you, Congresswoman Rodgers. Mm-hmm. What do you hear from the people in your district as far as what they're struggling with here, 2021, in terms of accessing the health care that they need?
Right. Well, we know that the Affordable Care Act promised to bring down the cost of health insurance on average by $2,000. If anything, it's been the Unaffordable Health Care Act, because not only has insurance gone up, but co-pays, deductibles. So people actually are paying more now today than ever for their health care. And it underscores the importance of price transparency. That is the way that we fundamentally restore the doctor-patient relationship. Because right now there's a lot of hidden cost, and these hidden costs are not disclosed, and patients, doctors need to be more informed as to what the cost of the treatment is. And that's how you're going to bring back competition among healthcare providers. That's how you're going to make sure that individuals are equipped to make the best decisions for themselves. So I believe that we need to really lead right now on price transparency for healthcare. That's foundational to a lot of the reforms that we want to bring forward to ensure that we are delivering quality care at the lowest cost possible. But we also need to make sure that we are leading in curing diseases. You know, I think about the impact of curing cancer or delaying the onset of Alzheimer's. It would transform people's lives, but it's one of the best things that we could do to bend the entitlement cost curve. And that's why proposals like Speaker Pelosi's drug pricing scheme would actually result in us being a damper on cures and treatments, but it would limit access, and it would cost us that future innovation that's going to improve people's lives. It's going to help us cure diseases, bend the cost entitlement curve, but also increase life expectancy and outcomes, the quality of life that we've enjoyed as Americans.
David, thank you for that, Congresswoman. David, I'm going to invite you to join us at the table, and I think of the coffee mug that you have that says coverage not equals care. Coverage does not equal care. Mm-hmm. David, join us in kind of giving your thoughts as to the state of affairs today, where we stand as a nation in terms of healthcare in America.
Well, I appreciate very much what the Congresswoman has said. She's spot on. Where we are today is we don't have a free market system. People always say we've tried the free market, so it's now time to go for a Medicare for all solution or a government-sponsored, government-run type of healthcare system, and that's just the wrong thinking. Because number one, we don't have a free market. We haven't had one for over 60 years, and in fact, government has emboldened many of the organizations that are concealing their prices. Transparency is an issue. Congresswoman Rodgers said that. We can't see what the prices are. By virtue of that point, we don't have a free market at all. So we need, what more than anything, is to have patients be in charge, patient empowerment, giving them a sense and a peace of mind. That comes from them being in a relationship with their physician. Having run hospitals, it's important for everybody to know that healthcare is local. The community and the family level. How on earth are we going to have those decisions made in DC for the folks in McAllen, Texas, or in El Paso, Texas, or Houston, Texas? That needs to be done at the local level. What needs to be done most of all are policies that are pushed through that allow for more transparency, that will give us the opportunity to mitigate the existence of these needless middlemen. We talk about the high cost of medications. I will tell you that most of those dollars are stuck in the middle in the supply chain, whether it be group purchasing organizations or pharmacy benefit managers, or name the three-letter acronym and it'll be there. And they're extracting value and not providing very much in return. So there's a lot to be done, and there's a lot to give the power back to the American patient in this country.
That's well said, and thank you for that. Congresswoman, I want to pull out a couple of the key words that both you and David had mentioned. And one of the things to start with is the role of transparency in your vision for the future of healthcare. We know that one of the accomplishments of the past administration was a price transparency rule at the national level that actually, congratulations to David, we've just recently passed a law at the state level to also call for that. But what are we talking about when we're talking about transparency, and why should that matter to the average American who's just wanting the best healthcare for their families?
Well, price transparency is really fundamental to restoring the doctor-patient relationship. It's fundamental to empowering patients to know, to be able to be equipped to make those best decisions as to quality and cost. And right now, others are making that decision. So that's why it's fundamental to restoring the doctor-patient relationship. And as I mentioned, there's a lot of hidden cost right now. But as we make sure that if we can take steps, and I too want to just highlight the leadership of the Trump administration and the work that they did to bring price transparency through the administration as much as they could. I'm hopeful that they've started a process where now Congress will continue to build upon the reforms that they put in place that will bring more price transparency, because price transparency is the way that both the providers and the innovators will then compete with one another to deliver quality care at a lower price. And that's the American way. That's the way that we encourage innovation, but also make sure that the individual is equipped to make those best decisions for themselves, rather than someone in Washington, D.C., a federal bureaucrat deciding whether or not you get the care that you would want, or where, or at, they're the ones saying yes or no.
Well, and that's spot on. We want to have the control over our healthcare decisions, not to have those dictated by an unelected bureaucrat in Washington, D.C. David, can you help me unpack a little bit further, or maybe crystallize for me, how this transparency works in benefiting the individual patient? I mean, I think right now, most Americans who may not understand this think, well, I just walk into the doctor and then I pay the bill, right? And I presume that that's the fair bill. And, I got one doctor, so I'm not going to go, shop around doctors or something like that. But how does this translate to empowering the individual to have better access to healthcare?
It's a great question, and thank you for asking it. Before I get into that, I would like to just to dovetail on something that the representative just said. A lot of good work was done by the prior administration. Unfortunately, CMS in the last couple of weeks has come out and said that they're going to provide an exemption for hospitals and not having to provide the pricing related to Medicare Advantage plans. So with those insurance companies, they don't have to disclose those prices, which is a gift to the hospitals and does harm for the good work that is being done in providing price transparency. Now, thankfully, moments before this live stream, we just heard that we have our hospital price transparency bill that followed the language that came out of the Trump administration, was just voted off and headed to the governor's desk. It has more teeth so that we can see more compliance from the hospitals, which many of them have chosen to pay the penalty rather than be honest with their prices for their communities. So we're looking forward to seeing what that will do in the state of Texas and helping our brethren in other states. How does that help patients? It's a great question. Let me give an example. Let's just say that I'm a patient and I have an insurance relationship with one of the big insurance companies. And there are two hospitals in my town, or two hospitals in the area, and they both are in network with that insurance company. My doctor has said that I need a CAT scan of the abdomen, let's just say. One hospital is part of a big system, and they were able to negotiate with my insurance company a rate of $2,000 for that CAT scan. The other hospital is just a one-off hospital in the community, and the best that they could do, because they don't have the market power to leverage their better rates, they're able to negotiate $1,000 for that same CAT scan. And all things being equal, if I have that information available to me as a patient, where am I going to go? I think that's a pretty easy decision to make, but patients don't have that information today. And it's something we need to improve upon and empower them with.
And it's not just in the abstract either. David, you shared with me some data that you showed that came from this Trump administration price transparency rule, where they went and got the data from specific hospitals, and were able to show that, for example, for the identical same prescription drug, depending on your insurance plan, some plans were paying 10 times or more greater amount for the same pill from the same hospital. And that just drives up costs when, three people can go to a hospital and they're going to end up paying three different prices for the exact same drug or the exact same procedure, because they don't have the information for themselves to be able to negotiate or be able to shop around. So,
And the variance isn't just regional. It could be within the same hospital itself. So one hospital for, say, a hip replacement, it could be $40,000 for one insurer. It could be $20,000 for another insurer in the same facility. There's an amazing amount of disparity and variance in the prices in the same hospital.
Now, Congresswoman Rodgers, I know you would agree that we have some of the finest doctors in the world. We have some of the finest healthcare institutions in the world. You mentioned innovation. How do we set that loose? What are we talking about on innovation, and how do we capitalize on the brilliant minds that currently practice medicine in this country, that do research, that develop new products? How do we get out of their way to come up with not just the solutions for today, but the solutions for the future?
Thank you, and I completely agree. We do have some brilliant researchers, and we are leading in our healthcare systems, and our providers are extraordinary, and they do need to be unleashed. We've just been through a really difficult year with COVID-19, and we're celebrating Operation Warp Speed, the fact that it was a public-private partnership that brought the vaccine forward in less than a year. Another example of American innovation and leadership. From my perspective, coming out of COVID-19, our goal should be to usher in a new era of innovation and entrepreneurship, and it means unleashing the innovators and the researchers, rather than the approach, unfortunately, that is being taken right now by the Biden administration, by Speaker Pelosi and the majority, especially when it comes to healthcare. We're debating right now in front of the Energy and Commerce Committee legislation that would bring government price controls for prescription drugs. It's estimated that it would cost the over 100 new drugs into the marketplace in the next 10 years. This is going to stifle innovation and research. And you think about the impact that that's going to have on real people's lives. We are on the verge of just amazing breakthroughs, and we should be leaning into this as a country. We should be leading. It's going to improve people's lives. It's going to help get our economy going. Plus, it would bend the entitlement curve out, whether it's curing diseases, whether it's Alzheimer's. If we could delay the onset of Alzheimer's even by 5 years, we are talking hundreds of billions of dollars in less cost within our entitlement and programs. But Speaker Pelosi and the Democrats want to impose these government price controls that would have us follow the lead of like the UK and Canada, where they have socialized healthcare. People wait much longer, and they have access to about half of the innovation that we do. That's not the future. That's not the American way. And we need to make sure that this legislation doesn't pass, first and foremost. And we need to continue to build upon the work that the Republicans did around 21st century cures and Operation Warp Speed, and make sure that America continues to be the innovator in curing diseases and improving outcomes and quality of life for millions of people here as well as around the world.
David, and very well said. Thank you, Congresswoman. David, with the example of Operation Warp Speed, we've seen, when these red tapes and regulations are set aside, really what the private sector is able to deliver. In this instance, I think delivering vaccines in a record period of time. But explain to me a little bit more about, why price controls, which advocated from the left on their face just seem to be like, well, it saves you money, right? Why is that bad? Why is that, more expensive in the long term? And what's that going to result for, individuals that depend upon prescriptions and medical procedures to be able to manage their daily health?
Well, like I said, we're already seeing a manipulation of the private market by the government. This is price caps and setting rates is just doubling down on a failed effort. As I mentioned before, the middlemen in the supply chain, they benefit from a safe harbor from the anti-kickback statute. And many of you are going to want to rewind what I just said and wrap your brain around that, because why would anybody be given a safe harbor from an anti-kickback statute? Yet they benefit from it quite a bit. But if you were to put price caps and manipulate how private organizations are functioning, they're going to take their wares elsewhere. They're going to put less options on the table. It's not consistent with our ideals of capitalism, which can work when government gets more out of the way.
Just one example, I think I remember you telling me last year, the year before, where I think the state of Colorado mandated a price cap for a particular product. But the reaction was, great, now you'll never pay less, because everyone out there is going to be, against the ceiling and actually end up driving up cost, have the backwards effect of that proposal. Congresswoman, in some ways, if you look at what Senator Bernie Sanders advocated for during the last campaign, if you look at some of the messaging from the left, their argument is the problem with the American healthcare system is that there's just not enough government. It really is. I mean, it seems astounding to me, but with the idea, I mean, you reference Canada, you reference the United Kingdom, these continue to be pointed at by the left as the models for them, where, government controls everything and therefore provides everything for the people. How is that why is that bad? How is that really contrary to the goals of what Americans want in terms of affordable access to healthcare?
Well, all you have to do is talk to anyone who lives in Canada, lives in the UK, hear them talk about their healthcare system. It's a very different experience than what we enjoy today in the United States of America. You hear about people that have to wait months to get care, even years to get cures or treatments that patients in the United States get first. And that's part of the reason why people come to the United States of America. My son has a disability, and I don't want the government determining the value of his life or determining his access to healthcare. And yet in these other countries, that's exactly what they do. They put a quality of life, a value of life onto that individual, and then determine whether or not that individual is going to get access to healthcare. You see it done with people that may be older also. So that's where the United States of America, our healthcare system has been based upon, first and foremost, the dignity and the value of every person. And our goal has been to make sure that we are saving as many lives as possible, giving people hope for the breakthroughs. We've led in research, in innovation, in curing diseases. Even the experience with cancer today is so much different than it was even 5 years ago. So if you pass price controls on those that are investing in the research and really trying to figure out, how we can even do better. So if you put price controls on that, what's going to happen is that there's going to be and in Speaker Pelosi's proposal, it's limited to the prices that they charge in other countries, but it also means that they don't have access in other countries. And then if they go above that level that the government determines, then they get slapped with a huge tax. 60-90% tax. It's going to be a disincentive. It is a big damper on the risk-taking nature that has defined Americans. That is the reason that we lead in breakthroughs and cures. And the Congressional Budget Office estimated that with this bill alone, the drug pricing cap, we would have as many of 100 fewer drugs entering the market. And what that means is cures and treatments for cystic fibrosis, for diabetes, for cancer, for Alzheimer's, life-saving promises that are in the works and we're on the verge of discovering. And we need to lean into that and lead and actually focus on how we improve people's lives and improve their quality of life, as well as cure the diseases that we're on the verge of doing.
I completely agree. And I mean, the takeaway from that is that, Americans need to understand that the alternative to your vision and what our American healthcare system was built to do, the alternative to that is denial of care, is rationing of care, is reduction in innovation and opportunities to cure diseases, and we know that because that's what's happening in other countries that are pointed to as the model. David, we talked about the far extreme of socialized medicine, but yet there are the gradual steps that continue to be advocated by the left that seem to be a one-way ratchet in that direction. Speak, if you would, briefly to what's been happening in terms of the expansion of subsidies under the Affordable Care Act, as well as this idea that was proposed by Biden last year in the campaign as far as a public health option. How is that ratcheting us towards what Congresswoman Rodgers was describing as far as the damage that these ideas would cause?
Another reason I'm thankful for Representative Rodgers is she's one of the few folks in DC that understands the difference between healthcare and health insurance. Most of the time when you hear a politician in DC talk about healthcare, they're not talking about healthcare the way that everybody else understands it. They're talking about health insurance. The ACA is not healthcare, it's health insurance. The subsidies are benefiting the insurance companies, not people. And honestly, we talk a lot about the uninsured, especially in Texas. We have I think close to a little over 5 million people that are uninsured. But helping the uninsured isn't just a matter of making sure everyone has insurance. It's making sure that they have insurance that gives people access to health care. And we really don't think about the second part of that statement. Giving them a lovely card in their wallet is not giving them what they need, which is why we've seen a surge in the number of people going to the emergency room. And as a guy that used to run hospitals that had ERs, I can tell you that's not where you want to go for non-urgent care. We need to focus on the doctor-patient relationship. We need to focus on more primary care. We need to focus on getting more residencies. We need to focus on getting private equity out of the business of medicine. We need to focus on bringing it back to a local level. And it's incredibly important that we make a difference, or we make a distinction between health insurance and health care.
Congresswoman, your reaction as well to what we've been seeing in terms of the, proposed propping up of the Affordable Care Act and also the ongoing discussion of the public option. Why do those go in the opposite direction of what you see as the right path for healthcare in America?
Well, I completely agree with what David was just saying. There's a big difference between healthcare and health insurance. And there's been examples where people have approached me where they have, well, even a Medicare. You think about Medicare or Medicaid in Eastern Washington today, it's very hard to get a doctor at times that will take a Medicare patient because they don't reimburse for the actual cost of the healthcare that is being provided. Medicare, they reimburse at a percentage, and Medicaid is even at a lower percentage of the actual cost. How they balance the books is on the private pay. And that's where the government, the promises sound good, and that's where I often say, but they're false promises because they never have enough money. And so then they are cutting reimbursements to the providers. They are creating waiting lists for actually getting care, or it gets harder to get an appointment. And there's a limitation put on even what you have access to. They're denying care. So that's where we need to make sure that we continue to promote policy solutions that are actually going to bring down the cost of healthcare, that are going to empower the patient and the doctor, like price transparency, to make those best decisions for themselves.
David, a question for you, and then here shortly we'll get to the questions from our audience. But what are some examples, David, today, some concrete opportunities that individual Americans should be pursuing or could avail themselves of to help them in accessing better, more affordable health care? What are some things that may not be commonly known that are worth exploring, or at least looking into and researching?
Right. Well, we've developed a tool at Right on Healthcare. If you go to texaspolicy.com/shopping list, we have a list of laboratories, pharmacies, surgery centers, doctors that all post their cash prices at a very affordable rates that you can pick and choose from. There are also the Christian sharing ministries that offer good, affordable coverage. And in Tennessee and Indiana and a number of other states, their farm bureaus are offering health benefits. And in the state of Texas, we are looking at putting forward alternative coverage options that will provide health benefits at affordable rates that are going to give people the peace of mind that they need. And we're hoping to see those get across the finish line here in Texas. But it's important for, I would say first and foremost is get a primary care physician, get a direct primary care doctor, get somebody that you can have a relationship with that can help guide you through this incredibly complex system. It's important. It's important for a number of reasons. One, so that you can focus on a preventative health relationship, but also so that they can guide you and somebody who knows who you are. So lots of things that can be done, but those are just some of the few.
Well, some great examples there in Congresswoman Rodgers. I mean, that seems to me to fit into what you were alluding to as part of the innovation, as part of the options, not just with healthcare companies that are researching future cures and diagnoses, but also with options that are available today that people can take care of, like transparency.
Yes. Absolutely. Price transparency is foundational. Direct primary care. Congressman Dan Crenshaw from Texas is also on energy and commerce, and he's leading the charge on that. We do need to recruit more doctors. We need to get more residencies in place in America. We do have a doctor shortage coming up. But one of the I think positives, or one of the lessons that we learned, let's put it that way, in COVID was that telehealth is part of a solution. And that's an area where I believe that we need to continue to promote more access to individuals to be able to get their health care or access to their provider, no matter where they may be. And it was embraced by both patients and doctors. So that's something that we're going to be working on this Congress, is to make sure that those kind of options are made available to the patients.
Well, that's a great point. I'm glad you brought that up. I mean, the virtual health that's developed, the telemedicine, has been transformative. David, you've long been a champion of that, but especially if you live in rural parts of the United States, you just don't have a doctor to physically go see. And so you're right. That's the kind of innovation that, America can and should lead on, that you've been championing in Washington, D.C., that we've been working on at the Texas Public Policy Foundation. So now transitioning to some of the questions that we have, and this has been a great discussion, but I've got several questions that are coming back to socialism and are coming back to socialized medicine. And I know that we've discussed really what it is and why, on a policy perspective, it is bad. How should we talk to our neighbors? How should we talk to our communities in framing this and helping them to understand, really what's at stake here and why this is not the direction we should be leading our country?
Well, maybe I'll start and then David can
build
upon it. But when you hear that kind of a proposal, you're talking about a complete government takeover of our healthcare system. and it's going to destroy the innovation. It's going to destroy competition. And as we've seen with all the promises that the Affordable Care Act made to bring down the cost of health insurance for families, it actually is costing patients more. It will kick people off their private plans. It will raise taxes. It's going to ruin the incentives for innovation and competition. So for America to be the leader in continuing to innovate and have the best healthcare delivery system in the world, it means that we got to get government out of the way. Freedom is and competition and free markets will win in inspiring that next generation of not only breakthroughs in curing diseases, but also in the delivery of healthcare. That's where people need to be empowered, and at the state level in particular. You can see it in the important safety nets that Medicaid provide to some of our most vulnerable. But we need to empower, we need to make sure that the states have the flexibility to make those best decisions for themselves as to how to deliver healthcare through Medicaid to some of our most vulnerable. But right now, these states have to ask permission from the federal government for Medicaid waivers in order to have the flexibility to best meet the needs of these individuals. My state in Washington had to wait years for their Medicaid waiver. And I know Texas got one approved for 10 years, and now the Biden administration is taking that away. That's taking away the flexibility and the ideas at a local level that are going to result in better outcomes at a lower cost and really keep the healthcare delivery focused on the patient and the provider.
Oh, that's a great explanation there. David, your thoughts and follow up and specifically on the Medicaid waiver issue, how that is timely and relevant to our discussion here today.
Well, if I could talk about socialism, just the socialist question, and then come on to that one. President Obama did talk about the fact that deductibles and coinsurances would go down if the ACA was passed. People wouldn't go to the emergency room for their non-urgent health care, that they'd be able to keep their doctor. None of that happened. In fact, and the other one was, people shouldn't go bankrupt because of their medical bills. In every one of those instances, it has gotten worse. Mm-hmm. It's gotten worse. So for those who want more government in terms of a government-run option, you're saying, well, let's double down on what's already not working. And I'd ask you to consider that. Now, people will always consider the UK and the NHS and Canada and Costa Rica and a number of other countries. And I can tell you, I've been to a number of those. And the citizens there are wanting to come to the United States, especially when it's something that's rather important and critical, because they may have access, but the government gets to dictate when they get that access. And that's a scary proposition. In terms of the Medicaid waivers, Texas submitted for two, the transformation waiver and the maternal women and children's. Both were received on December 15th. They were accepted on January 15th, and on April 16th, one was accepted and one was rejected. The rejection was based on a procedural issue, nothing really on the substance of the application. And from my perspective, that has nothing to do with, it has everything to do with politics and nothing to do with the accuracy or the substance of the application itself. And creating that instability and insecurity is just really atrocious.
One thing that you said that jumps out at me, and Congresswoman, love to get your reaction on this, but you mentioned bankruptcy. And the statistic, I think one way, if you could measure, has the Affordable Care Act worked? We're 11 years into that policy, would be, as a measurement of bankruptcies caused by healthcare costs. And as a matter of fact, those have not gone down. But it's tragic that, one of the top categories, for example, of why people do a GoFundMe account is to try to pay their healthcare costs. And we spend a staggering amount of money in this country on healthcare, yet it's not working. People are going bankrupt. People are begging their neighbors and receive the charity of others, which is amazing, but still are in that position. So what are your thoughts on that?
Well, it is tragic, and nobody wants to ever see somebody put in a position where they're facing bankruptcy or don't feel like they can pay for their health care bills. That's where it's disappointing when the Biden administration or Democrats are rejecting solutions like health savings accounts that would be a way for an individual or a family to have that safety net, or some of the short-term plans that they rejected. We need to make sure that individuals and families have options in the marketplace, that there are more options made available to individuals and families so that they can decide what's going to be the best plan to meet their needs. And what we see on the other side is that they want the government to make all of these decisions and have a government-run healthcare system, which is really frightening to me as an individual. I want to be empowered to make those decisions, and unfortunately, their approach is one that just keeps limiting the options that are made available to the individuals and families, and force them into plans that are government-run plans.
Congresswoman Rodgers, staying with you on a follow-up question from one of our audience members, asking about the cost of bureaucracy in healthcare, and specifically that bureaucracy cost in Washington, D.C., and what we're looking at. What is the significance of that? And to this question specifically, how can we reduce the amount of bureaucracy within our healthcare system?
Well, that's a great question. We know that the government does not have a very good track record of running anything efficiently, right? You put and the same applies for healthcare. That's why getting it closest to the doctor, or to the provider and the patient, keeping it at the state level, getting price transparency is so important. We need that is how you bring accountability to a system, is that you require that people are transparent as far as what the actual costs are. And with that, then you're empowering the doctor and the patient. That's why these reforms that we're talking about are so important, because it's also going to result in a more efficient and effective delivery of healthcare.
David, I don't think anyone watching this would be surprised to hear that we have a big bureaucracy in healthcare. But what are your thoughts on that, and the need to address that, as well as the other issues we've discussed today?
It's rather simple. It's what we just heard, but and they all culminate into free and fair competition. That's it. We want free and fair competition. The more competitive forces we have at play, the more lean and more efficient and better run those organizations will be.
The last question I want to ask, and then lead into the conclusion of our program. This has been a great discussion. Thank you both for this. But the question couldn't be better timed, because at the Texas Public Policy Foundation, we're not a think tank, we're a do tank, and we always want to be action oriented. And so, David, I'll start with you and then turn to you, Congresswoman. But a question from one of our audience members are, what tangible steps are there that the everyday person can do to help in this fight for healthcare reform? David, I'll start with you.
Understand what healthcare really is. Don't listen to a lot of the folks that put themselves out there as healthcare experts. Get a sense for what your needs are, what's available in your community. Look to see what the resources are. And again, we have that tool and we can put that online. Ask for the cash price, because insurance is supposed to be a mechanism where they are purchasing in mass and bulk, so that they can offer services and products at a discounted price, right? That's what they're there for, also to transfer risk. It's often cheaper. And Art Laffer did a study, and I think it's typical that you would get a 40% discount paying cash than you would through your insurance company. Well, it's nonsensical. But it's something that I always tell folks to do is, even if you have insurance, ask the cash price. You'll be surprised that you can put more money in or keep more money in your pocket by doing that.
And David, with increasing use of these high deductible plans where Americans are paying thousands of dollars out of pocket before their insurance would even kick in the first place, that cash price is going to save you money in your bottom line, even if you do have health insurance. Congresswoman, action items for those watching today. What should they do? What can they do? How can they join the fight with you and the Texas Public Policy Foundation?
Well, number one, I applaud anyone who is listening, because first and foremost, you're becoming informed. And that's the first step, is to become educated on these issues, to become informed, and then to make your voice heard. Join the campaign for price transparency. There's a growing number of people that are calling for price transparency within our healthcare system. The Trump administration moved it forward in a substantial way, and we need to continue those efforts to call for price transparency. We need to continue to make the case that freedom and free markets will deliver the most efficient and most effective outcomes. And yes, there's important safety nets, but again, those safety nets, whether it's Medicare or Medicaid, think about Medicaid in the 50 states, those safety nets are best run at the state level, and ensuring that individuals and families have the ability to make those best decisions for themselves. We want to make sure that we solve these challenges within our healthcare system the American way. And there's this tug of war between freedom and free markets and socialism. And socialism controls, and it's going to empower the federal government to be making those decisions for you and your family, versus freedom and free markets, which believes in the individual being educated and informed to make those best decisions for themselves. And there's a tug of war, a huge battle underway right now in our country as to which direction we're going to go. But I would submit to you that America has led in raising the standard of living, in health outcomes, in curing diseases. We want to continue to work to ensure that everyone has access to quality and affordable healthcare. We need more options in the marketplace. And we're going to continue to work that at the federal level, but it also happens at the state level. What happens at the state level around insurance and insurance options that are made available makes a difference. So it's great to continue to educate people so that they can engage at all levels of this debate. But first, ultimately, we want to solve this the American way.
Very, very well said, and a great way to frame that. And I think in closing, for each of you, we always want to leave the Texas Public Policy Foundation and our events energized and optimistic. We're happy warriors of the foundation. And in the closing question for each of you, and David, I'll start with you. We've talked about a lot of the challenges that exist. We've also talked about some exciting opportunities. Where should we have optimism for the future of healthcare, and where should we look for that? And tell us what makes you excited about what you see as the future, or at least the potential future of what we're talking about would lead to.
And thank you for the question. I wouldn't be here if I wasn't hopeful, if I wasn't optimistic. There's a better way, and it's just a matter of educating and having people be informed, as the representative said. I'm excited about what happened today. We had a hospital price transparency bill that was voted out of Senate committee unanimously, voted off the Senate floor unanimously, out of the House committee unanimously, and then today off the House floor unanimously. What does that mean? Democrats and Republicans came together, saw that this was good for patients, and they're sending a good bill for the sake of Texas patients to the governor's desk. That's exciting to me. That's something to be optimistic about. how do we find these things where we can all agree, stand shoulder to shoulder, and get things done for patients and doctors who would be their partners in this endeavor? There's more opportunity for that, and those are the things that we're excited to fight for and to make happen, not only in Texas but in other states around the country and in our nation's capital.
Congresswoman Rodgers, to close, your optimism, your excitement for the future, share that with us, please.
My optimism for the future when it comes to healthcare is that we are really on the verge of some incredible breakthroughs. It doesn't matter which disease group, patient advocacy group that I meet with right now. They're excited about the research that is underway. And we came through this year with COVID, and the Trump administration led on Operation Warp Speed. We can learn from that, but we can continue to invest in research that's going to lead to more cures, curing cancer, treatments for Alzheimer's, rare diseases, that treatment for some of these rare diseases that won't happen in any other country in the world. These are families and individuals that are depending upon the promise of these breakthroughs that are going to happen in the United States of America. That is what gives me more hope than ever. And it's the future of healthcare is more personalized medicine. And as you think about really empowering the individual, again, it's innovation and technology that is being driven the American way through American ingenuity and creativity, that we are going to continue to see our quality of life and our outcomes improve.
And that's going to lead for a better future, especially with leaders like yourself that are leading on this issue, that are championing this issue. So, Congresswoman Rodgers, thank you so much for being with us here, for being a champion of healthcare freedom, for working with the Texas Public Policy Foundation, and everything that you do for us in Washington, D.C. David, thank you for your insight and your leadership on this issue as well. And I want to thank everyone that's joined us here today for this discussion. It's an issue that we can fix. It's an issue that we will fix with leaders like Congresswoman Rodgers leading the way with the research of the foundation to back that up. So I'm excited for what's coming next. I want to thank you both for our discussion here, and invite everyone that's watching to come back and continue to join us for these live streams again in the future. So Cathy, Congresswoman Rodgers, again, thank you so much. God bless the work that you're doing. And thank you for your time to join us today.
Thank you so much for having me, and just really appreciate your work too.
Thank you.